Hello, lovely people. Thank you so much for sticking with us. We appreciate all the previous comments on our last video, and we know you are so much interested in your health. So today's topic, we are going to talk about kidney failure, and we brought on a guest who is in the person of Mr. Ruben Dakon Labi. He is a nursing officer at Kolebu Teaching Hospital at the dialysis unit, and he is going to give us a whole topic and all the lessons that we need to know about kidney failure. Stay with us, we'll be right back.
Perfect Living TV, above and beyond.
Welcome back from that commercial break. Thank you so much for staying with us. We know that today is going to be a lot of teachings, and we are going to learn a lot about kidney failure because we've also heard a lot. Hello, sir.
Hi.
Oh, you're welcome.
Thank you very much.
Thank you so much for coming.
Thank you for having me.
Okay, we really appreciate that.
Same here.
Okay, so let's delve into the topic. We want to know about kidney failure. When someone says, I have kidney failure, what does it mean?
Okay. Before I go on to answer your question, let me send regards to my fellow colleagues in the noble profession.
Okay.
I salute all of you. Yes, when somebody says, I have kidney failure, even just as the name implies, kidney failure, yeah. It means that his kidneys have failed to perform its normal function.
Okay.
Just as simple as that.
Okay.
Yeah.
Wow. So, what are some of the symptoms that we are supposed to look out for so that you know that you have a failed kidney?
Okay. To answer that, kidney failure usually mimics malaria.
Okay.
It looks like malaria. So initially, somebody will be like, I have headache, I don't feel for food, I have chills.
Okay.
So an extensive lab results will prove to you that your kidneys are failing. So what then do you have to look out for? Before these clinical features will show off, it means the kidney failure has advanced or has gone progressively to its failing process.
Okay.
There will be oliguria. You say oliguria, like scanty urine formation.
Okay.
Instead of urinating about 150 ml in a day, you have about 500 ml in a day.
Wow.
If I say ml, 500 milliliters.
Okay.
Or let's take the small bottle of evoltic mineral water.
Yeah.
Yes, within a day. Though the person is drinking fluids and all that, he's giving that volume of urine per day,
wow.
which is an abnormality.
Okay.
The person feels heavy. If I say heavy, what do I mean? There is sort of water retention.
Okay.
The person sleeps and wakes up and then finds swelling of the feet, which we call periorbital edema.
Okay.
Or swelling of the feet, which we call bipedal edema.
Okay.
Or the whole body swells up, which we call anasaka. General body swelling. Yes. The patient will also feel something called palpitation. You just be there and then you feel your own heartbeat.
Okay.
When we check your vital signs, especially the blood pressure, it's high. When you do lab, especially the kidney function test lab, BUE and creatinine, when you do that, you realize that all your electrolytes are skyrocketing. They are going high. Your urea electrolytes are high.
Okay.
And then when you are asked to do something like an ultrasound, abdominal ultrasound, you realize that your kidneys are reducing in size and all that.
Wow. So when you see a pregnant woman's swelling feet, does it also mean something like that?
Oh no, it mimics it, but with the pregnant woman, immediately she delivers, it subsides.
Okay.
But with the kidney failure person, it goes on progressively. Okay. We call it pitting edema. When you press the feet of the pregnant woman, though it will indent, but it will gradually fill up or rise up. And then that of the one with kidney failure, that one too gradually rise up, but the one with kidney failure is different from that of the pregnant woman.
Wow, wow. So can we say that kidney failure is a permanent disorder?
Kidney failure is a permanent disorder. Can we say that?
Yeah.
It's relative.
Okay.
With kidney failure, we have two types of it. We have the acute kidney injury, which was formerly called acute renal failure.
Okay.
That one, your own body mechanisms resolve for the kidney to bounce back in functionality.
Okay.
But the other type, which progressively goes into the chronic kidney failure, is for life.
Wow. So, should we say that kidney failure can also be inherited, maybe from parents' genes or something?
Okay. If we say kidney disease, that one, we have certain diseases of the kidney that can be inherited.
Okay.
But kidney failure itself,
in general,
is not inherited.
Okay.
So with the renal disease or kidney disease itself, we have those called the polycystic kidney disease. That one is inheritable.
Okay.
But kidney failure itself is not inheritable.
Okay. Okay. So it's a condition that is meant for maybe you not taking care of your body well or something.
Well, that will mean or lead us into finding the cause of kidney failure.
Okay.
Right.
Okay. Yeah.
So with the cause of kidney failure, we have lots of causes.
Exactly.
We have hypertension, diabetes, and then even autoimmune. If I say autoimmune, instead of your body fighting against certain infections to it,
Okay. Yeah.
your body mechanisms rather see your kidney as a threat, and they
Yeah.
begin to fight it.
Wow.
Yeah. Apart from that, we have certain conditions that can predispose one to kidney failure.
Yeah.
We call something pre-renal when we take the kidney failure itself under acute kidney injury. We have pre-renal. Pre-renal deals with things that does not feed your kidney with nutrients. Let's say hypotension, or if the kidney itself does not get enough perfusion.
Okay.
When I say perfusion, the perfusion comes from the blood. So if there's chronic hypotension, you are prone to get kidney failure. If there is marked cholera,
Okay.
or chronic diarrhea, or even excessive bleeding,
Okay.
can lead to kidney failure. Then we have intrarenal. If I say intrarenal, things that are going on within your kidney,
Okay.
something like malignancy or kidney stones.
Okay. Yeah.
They can cause kidney
Also
failure.
do that.
Or we have the post-renal. Post-renal, things that obstruct the urinary outflow.
Yeah. Yeah.
Something like strictures or adhesions or tumors blocking the ureters from allowing fluids to come out. Yes.
So can we say that alcohol can also do such things to the body?
It's relative.
Because society normally says that if you see maybe an old man who has taken out alcohol for some time and the stomach is bloated and the lips are red, it means that the person has a kidney problem. Yeah.
All the alcohol, smoking, and your lifestyle, they can predispose you. They are predisposing factors that can cause kidney problem.
Yeah.
But they themselves, in actuality, does not cause kidney problem. Yes, they help your underlying factors to, push your kidney function or kidney failure to the bed. But they themselves do not cause kidney failure. So mentioning that your stomach will get swollen, your lips becomes red and all that. Usually, you can't say it's because of the alcohol.
Okay.
You need to do further checks to find out if the liver is affected.
Okay.
Yeah.
So it's all based on the liver.
That is in terms of these ascites. We call it ascites. Bloated stomach containing fluid. You need to find out if it is the liver that has been affected or not.
Okay, so we want to know at what point can you declare someone has a kidney failure?
Okay, so kidney failure we have is in stages. We have the acute one.
Okay.
That one the body will resolve by itself and then
It's done.
done. But if that is not well managed and it becomes a renal failure, then we are talking about the stages of renal failure.
Yeah.
There are 5 stages to that. Stage 1, there is normal kidney function. Okay. But other factors show that you are having some problem with your
minimal symptoms.
Kidneys. Good. And then when it comes to stage 2, there is a mild, damage to your kidney.
Okay.
So we base on your EGFR production. If you say EGFR is an estimated glomerular filtration rate. That is the time taken for urine to be produced in your glomerulus. Yes. So stage 2, you are looking at a EGFR value between 60 to 89. Yeah. And then stage 3, according to KDIGO, is an acronym. They have divided the stage 3 into 2. We have the stage 3A and stage 3B. Yeah. So with the stage 3A, the EGFR is producing about 44 to 59 of free per minute, per mils per minute, per 1.7 cube. And then stage 3B, the kidneys are producing between 20 to 39, stage 3B. And then stage 4, your kidneys are producing between 15 to 29.
Wow.
And 15 to 20, thereabout. I have to check my facts well. And then you are declared renal failure if your EGFR rate is less than or equal to 15. Now, you see, yes, you see these containers. They are just colored fluid. Colored fluid. So this EGFR, ideally, an individual produces about 120 mils of urine per minute. 120 mils per minute. If you take these 3 containers, you have 120 mils per minute. They are producing this urine in your glomerulus. But someone who has kidney failure, per minute, per mils per minute, is producing less than or equal to 15 mils. This is it. Less than or equal to. This is not urine. It's just colored fluid that I have produced just for purposes of demonstration and education. So you are declared renal failure when your EGFR value is less than or equal to 15 mils. And it will surprise you to know that research shows that majority of people walking around have say 3 kidney failure.
Wow.
They're just walking around.
And nobody knows.
Nobody knows.
So there are people who don't show symptoms at all?
Renal failure has a nickname called silent killer. Yes, just like hypertension. Silent killer. So you one day hear that, oh, we were just sitting here with him. I saw him last week. We saw him 3 days ago. But now we heard he's dead. It is a silent killer. Yes. So we usually advise people to check their labs at least every 6 months or annually. Yes. If you see any abnormality about you, just report to a polyclinic or any clinic nearby for prompt treatment.
Wow, so we've learned that we are supposed to be going for checkup. How many times have you gone for checkup this year? We know Corona has come and we are all home, but even after everything is done, we all need to go and check ourselves and see what is happening in our system, what we've lost and what we've gained so far. Let's go for a quick commercial break. When we come back, we'll continue.
Perfect Living TV above and beyond.
Welcome back from that short commercial break. Thank you for staying with us. I'm learning a lot. I hope you are also learning something. So now, let's go to our next question. What treatment is available for such cases?
You mean renal failure?
Yes.
So with renal failure, you are being managed on your drugs. Yes, we treat you, we give you conservative treatment. And then you are put on dialysis. Yes. And then the other option would be a kidney transplantation.
But most of us have heard of dialysis and we don't know what it involves. What is it all about?
Very good. So dialysis is a word that simply means removing waste from your blood using a machine. It's a layman's definition that will make him or her understand the procedure that removes waste products of metabolism, salt, water from the blood. It's an dialysis machine.
But don't we need this salt and water in our system, or it is becoming excess?
Good. So with renal failure, your kidneys have failed to carry out those normal functioning that it should do. So let's quickly rush through or go through the functions of the kidney. With that, we'll be able to understand all that dialysis.
General
yes. So let's just coin an acronym called a wet bed. A wet bed. A bed is wet. A wet bed. So where A means acid-base regulation.
Okay.
So your kidneys will regulate your acid and then your base. How does it do that? It has something called bicarbonate.
Okay.
Bicarbonate serves as a referee. It will not your acid level go high. It will not let it come down. It will not let your base level go high or come down. That's one of the functions of the kidney. And then the W will mean a water remover. You all know kidneys help us to urinate. And then the E will mean electrolyte balance. When we say electrolytes are substances that ionizes in water to produce electricity, something like salt, potassium, etc. So your kidney keeps your electrolytes balanced or regulated. And then the T will mean toxin remover. You know, most of the drugs that you take, food you eat, have been broken down by your liver. And then they are eliminated or metabolized by your kidney through your urine. And then the B will mean blood pressure regulation. The kidney regulates your blood pressure. Just like an iron, the thermostat on an iron. If you do excessive work and you pant, or yes, your kidney will click, cut, and then bring your BP level down to optimal level. And if your kidneys are your blood pressure is going low, your kidneys will have to readjust to bring it up. Especially if you are you are sort of met with something like a fearful something. You see, your heart will go up. Yes. So kidney does such function. And then the E will mean erythropoietin production. Erythropoietin is something that keeps your red blood cell in a normal level. The red blood cell contains something called hemoglobin. This hemoglobin contains oxygen that feeds the whole body. Now, if your kidneys are filled, your red blood cell or your HB, platelets and the likes are usually low. So every patient who has kidney failure or renal failure has low HB. Yes, that's why we usually advise them to take in a synthetic form of erythropoietin in the form of injection, which they take every weekly. And then the D will mean synthesis of vitamin D. So the kidney helps you to synthesize vitamin D together with vitamin C and phosphorus. So having known the functions of the kidney, then it means that anyone who has renal failure will be the reverse form of
all the functions.
So if you have renal failure or you have kidney failure, then it means your BP will shoot, your HB is low because of low production of erythropoietin and then low synthesis of vitamin D. You look weak. Yes. And then instead of you to urinate normally like people, your urine are retained in your blood. So we call it uremia. Formerly we call it azotemia. But now it's called uremia. And then now that the waste and all that are built in your urine, that is why dialysis comes in to remove the waste product from your blood.
So what are the different types of dialysis that we have, or is just one procedure?
No, we have two types of dialysis. We have peritoneal dialysis and we have the hemodialysis. So basically on my unit we do the peritoneal dialysis. We do the hemodialysis. The peritoneal dialysis we use your peritoneum. Yes, we pass a catheter to your peritoneum using normal saline to bring out the waste from your blood. And then the hemodialysis where majored or based, we use your bloodstream. Where that a doctor has to pass a catheter into your bloodstream, either on your neck or in your thigh, or you have to do something called AV fistula. AV fistula, atrioventricular fistula, yes, where we combine an artery to a vein, get a big blood access, and then you can use we have specialized dialysis needles that we use to take to do the procedure with the AV fistula. But with the catheter, we have to put the catheter either in your neck or your thigh, or in your thigh, and then we connect tubes called extracorporeal tubes, which we which we prime on the dialysis machine. Okay. Yes, using normal saline to expel all air in the tube.
Wow. With this one, I don't think you should make any mistake. Like when you are going to work, your wife shouldn't even disturb you or have any problem.
Fortunately, my wife doesn't disturb me.
Thank God.
And then
I'm even talking about this in general terms.
Yeah.
Like you shouldn't have any personal problem or emotional stress or anything, because you can really distract a lot of lives.
Yes. So before you enter your unit, you leave all your stress, your beef, your problem behind the door. Okay. And then you enter the unit with a smile, with fresh, mind to work.
Even if you are going through broken heart,
leave that behind your door.
Wow.
And then enter the unit and then work with open mind.
Wow. Yeah. Wow.
Because the procedure demands 100% concentration.
Yeah.
On the dialysis unit, your emergency medicine should be working.
Okay.
Because a patient might be on the machine and will be dying.
Exactly.
But fortunately, the dialysis machines beep.
Okay.
Anytime there's something wrong with the procedure, whether a patient has moved a bit and so the flow is not going as needed, the machine will beep.
Okay.
Yes, if the BP is high, the machine will beep. Whatever happens, if there's air in the tubes connected to the machine will beep. Whatever happens to the patient on the machine will beep. So you hearing that sound, you attend to the machine and you're correct.
Yes. Okay, so how long can you survive when it comes to dialysis?
Okay, so research shows that survival rate for kidney failure on dialysis is between 5 to 10 years. Okay. Yes, but I know other patients who have lived all this while do on dialysis for 20 to 30 years.
Okay. Yeah. So it depends on your system.
It depends on your system and how you take very good care of yourself.
Okay. Is dialysis painful? The process, all the time coming to the hospital and all these needles passing through your body?
Yes. The thing is, if you don't do it, you are either going to die.
Your survival rate is very low.
Either you are going to die or any untoward incident will happen. So imagine a needle being pricked you every other day, because you need to be dialyzed every other day, ideally 3 times in a week.
Woo!
Yes, ideally 3 times in a week. You need to be pricked every other day. The needle prick affects those who have the AV fistula. Okay. But those who have the catheter and all, they don't need any needle prick, because the surgical procedure has placed your catheter into your bloodstream. So we just need to unlock the site, pull out. We usually lock it with heparin. Pull out the heparin and then fix the extracorporeal tube. Put the machine on and then the process goes. But with those having the needle, the AV fistula patients, we need to just stick the needle in. But sometimes it's painful. Imagine a needle passing through your body every other day. Yeah. Some people even cannot afford the every other day. They do it twice weekly. So imagine a needle pricking you and all that. It's painful.
This is stress.
It's really painful.
A lot of stress. People say it's very expensive.
Oh yeah.
How true is that?
Very true. In fact, I know somebody who has sold the house.
Wow.
Yes, the whole house. Last week I spoke to a patient whose husband has been referred to as having stage 4. Okay. Stage 4. Stage 4, you don't need dialysis here. But because of the lives they're going to do, they need to sell the car. Yeah. You know? Wow. So the dialysis itself is expensive. The procedure for you to get the catheter in your bloodstream is expensive. The AV fistula is expensive.
Can you give us a general round figure?
So usually every hospital or department have the amount they charge. Okay. Yes. So when we mention that of Kolebu, or give you a general. So generally, at the initial stage, you are charged about 1,000 Ghana cedis just for the procedure.
Per session.
Okay, for per session at Kolebu we charge 325. 320 Ghana cedis per session.
And you have to come twice or 3 times
in a week. So do the calculation.
Wow.
It's not easy.
God, thank
aside
you for
that,
my life.
aside that, your labs, your monthly labs, you do monthly labs, pre and post dialysis. That one we do that to see if you are getting an adequate dialysis session. Once you're coming for the session, and then the drugs that you might even take. Some even people take transportation. You haven't factored in your meal. Majority of the patients on dialysis are breadwinners.
Do they work? Because
most of them
you
work.
have to be
Others
going to
drive
work and coming to the hospital
Yes.
all the time.
Yes.
It's going to distract work all the time.
Yes. Some are taxi drivers, some even man motor to the facility. Yes. Majority of them work.
Wow.
So it's expensive. So if you are able to drink and to urinate, please God.
This one is like you are just working to survive. You are not working to take care of yourself or luxury or anything.
Yes, you are right.
working because you want to be alive.
Yes. And your ends.
Yes, as soon as the money comes, it goes here and there. So there's no other emergency that comes into your life or anything. You can't even enjoy your life.
It's true.
Wow.
So most patients' children are out of school.
Yeah.
Others are out of employment because they have to make time for their daddy, mommy, brother, sister, friend.
You can't be poor having this sickness.
No, not at all.
You just say your last prayers and then
But
you
unfortunately, too, more than half of the patients.
Wow.
You see that thing.
Is it the preventive measures that wasn't done, or what is the problem?
Ghanaians or Africans in general, the self-medication aspect is there.
Yeah.
The let's wait and see. The prayer camp people are there.
Okay.
Instead of seeking prompt or adequate treatment, they resort to maybe other treatment other than orthodox treatment.
Yeah.
I don't mention anything to mean I've been spoiling other people's
We
business,
understand.
but in fact, it's certainly to see or hear the complaints people come to the hospital with, drinking a whole lot of concoctions. Some firms will tell you, I have this concoction or this medicine that can cure your problem, and then they go in and they rather come in worse.
So you've not seen anyone who has been cured by herbal medicines for this particular problem?
Then it means the patient wasn't in a chronic renal failure.
Okay.
Probably acute.
Early stages.
Early stages. So even that one, your body alone, plus the meal, your diet, and even the medicine that will be prescribed to you. Yes. And then how should I call it? Non-kidney damaging drugs or nephrotoxic drugs that you are not to take. If you are able to stick to that, yes, your kidney will resolve naturally by itself.
So what are some of the negative effects of dialysis, being on dialysis?
Negative effects?
Yeah.
Well, because your kidneys are naturally not functioning, and you need an artificial kidney, to do your, waste removal and all. One, you are always having low HB.
Okay.
Your blood, red blood cells. When you do your full blood count, you're always having low HB. That makes you weak. Okay, so people will see you and they think you're always a sickler.
Yes.
They see you always a sickler. And then another negative effect is you have to be at the dialysis unit.
You're distracted all the time.
If you're not careful to have a boss that is understanding and loving, you lose your job. Some also have effect with their relationships, marriages and all. Okay. The disease itself also makes your bed matrix. How do you understand? With your wife or significant other low.
Yeah.
Because
women always have problems with that.
Yeah. See you.
Thank you so much for watching. Don't forget to give us your comments in the section below. Thank you.